Welcome everyone to our fourth progress report. My PhD focuses on oral contraceptives and cancer risk. And it started because there's a general fear among women taking or thinking of starting oral contraceptives concerning the risk for illnesses, including cancer. Since the incidence of many cancer types is growing, continuous research is essential to understand the effect of oral contraceptives on cancer diseases. In this systematic review and meta-analysis, we showed that oral contraceptives are not only safe, but women who use them are less likely to develop non-Hodgkin lymphoma. So women can use oral contraceptives safely and without the fear of developing non-Hodgkin lymphoma, and future studies should focus on understanding the protective effect of these hormones. I'm Tímea Hercsik, a medical doctor and a first-year PhD student. My vision is to lower rates of malignancies, and my mission is to provide preventive measures for hematological and lung cancers. Currently, I have two ongoing projects. The first one is assessing the relationship between oral contraceptive use and hematological cancer risk, and the second one does the same regarding lung cancer. But why is this topic important? There are more than 150 million women worldwide who are using oral contraceptives. Besides, cancer is the leading cause of death with a rapidly growing incidence and mortality. So revealing any association between these two factors can greatly impact women's health. But there are still conflicting results in the association in the literature, and more importantly, a fear among women about hormonal contraception. So our first project focuses on hematological malignancies, which include a wide variety of cancers affecting the blood, the bone marrow, and the lymphatic system. They can be divided into lymphoid and myeloid origin, and malignancies of lymphoid origin can be further divided into Hodgkin's lymphoma and the more heterogeneous group of non-Hodgkin lymphomas. And malignancies of myeloid origin are a similarly heterogeneous group. While the incidence is increasing worldwide, especially in developed countries, women generally have lower rates, and this could be explained with a variety of factors. The observed higher cancer risk in men has been attributed to increased exposure to environmental carcinogens. However, this can only offer a partial explanation for the sex dimorphic differences. And the sex hormones are known to play a role in hematopoietic stem cell development. They control their self-renewal, their differentiation and proliferation. And estrogen has been shown to have a protective effect against hematological malignancies. Therefore, we aim to investigate the association between oral contraceptive use and hematological cancer risk. We hypothesized that oral contraceptives decrease the risk of hematological cancers. We used the PECO framework. We investigated women who took oral contraceptives and compared their hematological cancer risk to women who did not use oral contraceptives. Here's our search key. It consists of two domains. The first one is created for the exposure, and the second one is for the outcome. And we conducted our search in three databases, PubMed, Embase, and Cochrane Library, on the 23rd of November. By the end of our selection process, we ended up with 19 eligible full text. And now we are in the phase of manuscript perfecting, and we would like to submit our paper to the British Journal of Obstetrics and Gynecology. So let's move on to our results. First, okay, so here we compared the non-Hodgkin lymphoma risk between two groups, women who took oral contraceptives and women who did not. And as a first approach, we analyzed the longest durations from each study. And here the statistical outcome is hazard ratio, and we analyzed 4 cohort studies, and the pool hazard ratio is 0.88, which means that women who took oral contraceptives were less likely to develop non-Hodgkin lymphoma, which is clinically relevant and also statistically significant. As a second approach, we try to define different levels of exposure to see whether the effect of oral contraceptive use has anything to do with the duration. Here the statistical outcome is odds ratio, and we analyzed 3 case control studies. and the pool dose ratio in the short duration group is 0.71, and in the long duration group it's 0.47, which means that women who took oral contraceptives were less likely to develop non-Hodgkin lymphoma, with a more prominent effect observed with a longer duration of use. So our study strengths are its rigorous methodology, of course, and that we could make an analysis for the duration of use, oral contraceptive use. However, the low number of studies and lack of information of oral contraceptive types are the limitations. So in conclusion, women who use oral contraceptives are less likely to develop non-Hodgkin lymphoma, with a more prominent effect observed with the higher durations of use. So women can take oral contraceptives safely and without the risk of developing non-Hodgkin lymphoma. But future studies should focus on understanding these protective effects, and they should report more information about the oral contraceptive types and dosages, and they should be more detailed about the hematological cancer types also. So let's move on to our second project, which is investigating the effect of oral contraceptive use on the risk of lung cancer. Lung cancer incidence has increased in the recent decades. In 2022, it was responsible for close to 1 in 8 cancers diagnosed and 1 in 5 cancer deaths. Thus, it's the second leading cause of cancer death among women. Cigarette smoking is one of the greatest risk factors for developing lung cancer, and within the smoking population, men are more likely to develop it. However, among non-smokers, women are about 2.5 times more likely to develop it at a younger age. And these differences have been attributed to sex steroid hormones. Estradiol has been shown in vitro to induce the proliferation of lung cancer cells, and in animal models, progesterone was able to inhibit their proliferation. So it may suggest that they have a role in lung cancer pathogenesis, but it remains unclear. Therefore, we would like to investigate the association between oral contraceptive use and lung cancer risk. We hypothesize that oral contraceptives increase the risk of lung cancer. We use the same PECO framework. We investigate women who took oral contraceptives and compare their lung cancer risk to women who did not use oral contraceptives. And so we can provide an informed choice of contraception. Here's our search key for the second project. It consists of 2 domains. The first one is created for the exposure, and the second one is for the outcome. There's a previous systematic review and meta-analysis which analyzed both endogenous and exogenous hormones, but it has articles up to 2019, and several studies came out since then with a different conclusion, and there's no dose response nor time response relationship assessed in this paper, and there's no Prospero registration. So in summary, we have 2 ongoing projects right now, and we would like to submit them until the end of this year, hopefully. And I would like to end my presentation with a quote from Marshall McLuhan: "Whoever discovered water wasn't a fish." And thank you for your kind attention.
Yes, thank you for your presentation. I'd like to ask regarding your first project, if authors provide any information about the type of oral contraceptive, what they use? No, okay.
Yeah, that's
so
a
you
limitation, yes.
Okay.
Yeah, I should underline this question, because we're never talking about oral contraceptives. We're talking about combined oral contraceptives, progesterone-only pills, whatever. So really, I feel. So I'm not sure how can we use this in a daily practice, your results, because we should clearly distinguish combined oral contraceptives and only progesterone and progesterone implants and vagina ring and whatever.
Yeah,
so
it's just about oral contraceptives. I know that it's not the best option, that we cannot differentiate, but the studies didn't differentiate. They just pulled them in if they took oral contraceptives or not. How many of them had cancer, and yeah.
Okay, good. There is as far as I know, there is one histology type, lung cancer, when oral contraceptive, combined oral contraceptives are protective. Do you know which histology type is that?
No.
This is the adenocarcinoma.
Yeah.
Okay, thank you.